This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted that you're here. And today we're going to be talking with Dr. Cami Banks. She's a cardiologist at Texas Health Presbyterian Hospital in Allen, and she's the medical director of cardiac rehabilitation also at that same facility. Dr. Banks, welcome to the show.
Thank you for having me.
You know, as we look at some of the increases in hospital visits, hospital stays during a pandemic, can you give us a little hint or advice on what accounts for that increase?
Absolutely. The main contributor to the higher rates of COVID in the community is COVID fatigue. So remember that we are in our 10th month of this pandemic, and people are just tired. They're tired of wearing their masks. They're tired of social distancing. They're tired of their events being canceled and worrying about their finances. They're just tired. So as people become tired during this pandemic, we are not seeing as many people as we would like adhering to wearing their masks and social distancing. When you add to that it's winter and we're having more gatherings indoors and it's the holiday season and some of those events are a little harder to resist, there's no wonder that we are having higher rates of COVID in the community. Once we have higher rates in the community, of course, then we'll have higher rates in the hospital. And it's unfortunate, but in some hospital systems, we are seeing about a third of patients that are being hospitalized with COVID infections, and that's really high.
A couple of questions I want to ask you kind of back to back. First, could you explain your definition of broken heart syndrome? And second, with the winter holidays really in full swing, do you anticipate more cases of broken heart syndrome?
So broken heart syndrome is a condition in which a person experiences acute cardiac dysfunction, where portions of the heart muscle balloon outward instead of contracting inward in a normal way. And in the beginning, it mimics a heart attack. The individual may have chest pain or shortness of breath. The electrocardiogram may have different changes and laboratory data, all of which may point toward a heart attack. But unlike a heart attack, we find no blockages in the heart arteries. The heart arteries are clear of disease. And broken heart syndrome can occur with severe medical illnesses, but also during times of severe emotional stress. So during a pandemic where we see increases of medical illness as well as increases of stress, we also see increases of broken heart syndrome.
That is amazing. And it does mimic some of the symptoms of a real heart attack. Have there been any recent studies done on this or any significant findings that you're aware of?
Absolutely. One important study was performed by the Cleveland Clinic researchers, and they looked at the rates of broken heart syndrome before the pandemic and during the pandemic. And what they found was a 4-fold increase in broken heart syndrome during the pandemic as opposed to pre-pandemic. That's a very large increase. And it really tells us that what the physicians are seeing in the community is really validated. Broken heart syndrome is on the rise, and we need to be on guard.
Along those same lines, to be on guard, are there suggestions or nuggets of information that you can give us how we can be proactive to lower the stress associated with broken heart syndrome?
Absolutely. There are many ways one can be proactive when it comes to preventing broken heart syndrome. We can take measures to protect our physical health, but also our mental health. So when it comes to COVID-19, we should think about 3 different things. First of all, please mask our face, but let's not mask our feelings. Secondly, We'll be washing our hands more often, but we also need to remember that we need to think of ways to wash away the stress. And finally, we want to be distant, but we don't want to be disconnected.
You know, we know that stress is obviously the trigger of broken heart syndrome, but are there some key risk factors also that we should know about? And does it affect one gender differently than another?
Yes, so broken heart syndrome is also called stress-induced cardiomyopathy. And we find that extraordinary stress due to physical illness or emotional illness is really what leads to this condition. Interestingly, women have a much higher rate of broken heart syndrome or stress-induced cardiomyopathy, and we don't know exactly why. But these are the things that we know lead to broken heart syndrome.
So let me ask you this. If someone should be diagnosed or suffer from this, what type of medical treatment do you recommend and is available for these individuals?
So the treatment for broken heart syndrome has three major components. First, we must treat the stressor. If that is a medical illness, we must treat the underlying medical condition, such as COVID-19 or any other medical stressor that could be going on. Secondly, we must treat the cardiac dysfunction. There are standard cardiac medications that we use in cases of acute cardiac dysfunction, and we need to be sure that we have those medications available. And then thirdly, broken heart syndrome is a condition that improves with time. What that means is that we need to provide all the support and all the medications until the heart itself recovers.
You know, you've mentioned some really good things and good advice. And you also, at the beginning of my questions, talked about hospitals and hospital stays. But I'm sure in your practice, especially during May and June, there were many people, because of COVID-19, that were afraid to call 911. They were afraid to come to the hospital. And as a result, many people had heart attacks. Some even, unfortunately, passed away, and some had strokes. Do you have any advice to our listeners about don't be afraid to call 911?
Yes, we are in the middle of a pandemic, but we still know that heart attacks and strokes are happening. And you are safer in the hands of medical professionals if you are to have chest pain, shortness of breath, or one-sided weakness. If you have any of these symptoms, please call 911. We're here for you.
You know, you bring up such good advice. Thomas and I interviewed a neurosurgeon the other day and said that they had found preliminarily that if you have COVID-19 and don't come in and take care of yourself, your chances of having a stroke or cardiovascular problem go up tremendously. So great advice.
And Steve, we have more great advice from Dr. Cami Banks. She's cardiologist at Texas Health Presbyterian Allen, where she is also medical director of cardiac rehabilitation there as well. And we are going to talk more about this broken heart syndrome. And this interview is also on our podcast on all the major podcast players. Just search up The Human Side of Healthcare. We'll be right back after this quick break.
This is The Human Side of Healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. We're continuing our conversation with Dr. Cami Banks. She's a cardiologist up at Texas Health Presbyterian Allen. She's also a member of Texas Health Heart and Vascular Specialists, which is a Texas Health Physicians Group practice. She's telling us about this broken heart syndrome, and especially elevated now with COVID-19. So the first place we'd like to pick up is with what exactly stress does to our heart.
Yes, with excessive amounts of extraordinary physical or emotional stress, the body releases hormones. And these hormones, stress hormones, can act upon the heart, causing it to dilate, and specifically portions of the heart not to move as well as the other portions, which then leads to cardiac dysfunction. This doesn't happen with every stressful event or even most stressful events. But if there's extraordinary stress, this can happen. We've all heard of people that have known of a person to die, and then their spouse later on, we hear dies of a broken heart. This is the kind of extraordinary stress that we're talking about that can sometimes cause broken heart syndrome. So not with every stressor, but with extraordinary stress, this can sometimes happen.
Take us on down that road 20 years later.
That's a great question. So the positive thing about stress-induced cardiomyopathy or broken heart syndrome is that it often recovers with time. So during the stressful event and after the stressful event, the heart balloons out, doesn't contract as it should. But with supportive care and good medications and time, in the majority of cases, broken heart syndrome or stress-induced cardiomyopathy will recover and the heart function will come back to normal.
So it physically gets bigger?
During the stressful event, yes, the heart specifically gets bigger. In fact, when it was first discovered, it was called Takotsubo syndrome because the way the heart is shaped, it mimicked the shape of a Japanese pot called a takotsubo. So the top part of it balloons out. But then it will come back to normal in most cases with the appropriate medical care.
What is the treatment protocol?
So it really depends on how ill a person is. For example, if the heart is ballooning out and is not performing its job of delivering oxygenated blood to the body, then as cardiologists, we have to help that along. We have to remove excess fluid from the body if the heart is not pumping well. We have to provide supportive medications to keep the strength of the heart up. We also have to provide medications that help in cardiac remodeling, that long-term cardiac remodeling. Those medications can be diuretics, beta blockers, ACE inhibitors, those type of medications.
Are valves part of this at all?
So not directly, but indirectly. If the heart balloons out enough and stretches out enough, then that can stretch the annulus of a couple of the valves and cause the valves to leak more than they ordinarily do. But the stressful event does not directly affect the valves.
And leaking valves is basically fatigue. How would people spot if perhaps they were having a valve leak?
So oftentimes valvular leak or valvular regurgitation is asymptomatic. You wouldn't feel it. But if a significant proportion of the blood goes backwards instead of going forwards, people can experience shortness of breath, issues with water retention, swelling in the abdomen or legs, and fatigue. Those would be the top symptoms for someone who is experiencing significant or acute valvular regurgitation.
Can broken heart syndrome lead to stroke?
Yes, broken heart syndrome can lead to stroke. If, for example, the cardiac dysfunction is so great that the brain is not receiving enough oxygenated blood, that's one way. A second way is if the cardiac dysfunction is present long enough, you can get clots in the heart, and those clots can break off and go to the brain and cause stroke.
So it really is almost kind of a similar microcosm of arrhythmia. Is that close to correct?
I would say, so with arrhythmia, so when we think about cardiac dysfunction, okay, we can think about the pumping of the heart, the pipes of the heart, and the electrical system of the heart. So when I'm speaking about dysfunction, I'm really speaking about the pumping of the heart. But you are right in that there are also electrical issues of the heart. So atrial fibrillation and other rhythm disorders are problems with the electrical system of the heart. And the way that that works is that if the heart is not beating in a synchronized, organized way, then clots can form in the dependent areas of the heart and then those can break off and cause stroke. But you do not have to have a problem with the pump of the heart in order for that to be the case.
Sounds like we can treat the heart medically, but really to resolve this, we need to get to the bottom of those stressors. Is that in our sympathetic, parasympathetic nervous system? Do we do that through, I'm thinking things like yoga and exercise, and how do we chill out and get rid of this?
Don't we all need to chill out? We all need to chill out.
Chill out, man.
Absolutely. I think that for a lot of people during the COVID pandemic, we have let some of our usual self-care go. Am I right?
Yeah, no doubt.
The gyms are closed. So those people who used to go to the gym are not going to the gym, right? The people that like to socialize and get energized by being social that are not being able to do that. So there are many things that we were doing before the pandemic that we're not doing now that is affecting our stress levels. And we know from studies from all over the world that people are experiencing more stress, people are having more depression, people are experiencing more substance abuse, and none of these things are good. So in a way, we have to get back to our pre-pandemic self-care to help minimize some of this new stress that we're experiencing.
The faster the better, right?
The faster the better.
What can we do in the meantime, from your perspective?
We have to push through. We have to wear our masks. We have to socially distance. We have to find new ways of doing old things. We have to get the vaccine. All of those are the things that we can do in the meantime.
Are people dying from this? Is this fatal?
In very rare cases, is broken heart syndrome fatal. Most of the time, people experience acute cardiac dysfunction and heart failure, meaning that their body is not handling fluid well, and we can push through with medications. But rarely, a person may develop severe arrhythmias or cardiogenic shock, and that can kill you.
Okay, so obviously something to be taken seriously.
It is to be taken seriously, absolutely.
That's Dr. Cami Banks, cardiologist from Texas Health Presbyterian in Allen. Thank you so much for those great tips and points on something that, Steve, we wouldn't have sat and thought about on our own.
Absolutely. Great advice, great information, great points. When you think in terms of some of the things she went through and the anxiety and stress people have, and we're not political on this show and we won't be, but with all the unrest that's been going on over the past couple of weeks, people are anxious. And besides that, when you think in terms of the super spreader virus, even involved in some of the unrest and demonstrations, etc., people without wearing masks have contracted COVID-19.
Boy, we have had so much thrown at us really over the past 12 months. And, it's been whack-a-mole. We think we're coming out and then, bam, we get hit again. And like you said, when groups of people get together, there is a risk of somebody getting COVID. And I've been seeing these articles, too, over the past couple of weeks of how it really is negatively affecting some people. So one of the questions that comes up is about COVID-19 testing. Lots of confusion over this area. What kinds of tests are there and how do they work?
Yeah, we're going to have in our next segment Dr. Joseph Chang. He's the Chief Medical Officer at Parkland Health and Hospital System. He's got fascinating information related to testing. And in addition to that, some real good advice about vaccines, all scientifically based.
Not only does Dr. Chang have a huge prominent position in our community right now, but he also has some of the latest science, as you just mentioned. And one of the statistics is going to surprise you because we've learned that one of the two types of COVID-19 tests is only accurate under certain conditions just 30% of the time. We'll explain that whole scenario coming up next on the Human Side of Healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome to the human side of healthcare. We're delighted that you're with us today, and we want to drill down and talk about COVID-19 tests. What are the good ones? What are the bad ones? What do you as listeners need to know? We couldn't have a better guest than Dr. Joseph Chang, who's the Chief Medical Officer at Parkland Health and Hospital System. Joe, welcome to the show.
Hey, thank you very much, Steve. Really appreciated your partnership in all of our local endeavors in the past, and really happy to be here today.
Thank you so much. Well, we're going to jump right in. You know, Parkland Health and Hospital System has provided over 50% of the COVID tests in Dallas County since March. So what's the current COVID testing situation, not only at Parkland, but also in Dallas County?
Yeah, that's a great question and a really great way to start out. We're obviously very proud of our partnership with the city and all the county health officials and being able to open these drive-up sites where the public has really been able to access the COVID testing, even at the very beginning when tests were so rare and difficult to find. At this point, we are still operating those two sites in the city at Ellis Davis Fieldhouse and at our Eastfield site, and still have drive-up capability. An amazing thing what our workers have done over these last 6 months to provide all of that testing. Right now, of course, in Dallas County, we have access to a whole lot more testing at a whole lot more different sites. And so we have actually seen the volume of the drive-up testing go down since the prevalence of the test has really spread through the county. We actually think that's a really good thing that the Dallas County residents have access to so many more sites now.
So what are the different kinds of COVID tests? Please help us understand this better.
You know, really the tests fall into two main categories, okay? One is what we call the PCR test. That stands for polymerase chain reaction. And really all that means is this is a test that actually amplifies the DNA and genetic material of the virus itself. So it directly detects the DNA and genetic material of the virus. It is the first test that was developed, and to this date is still the gold standard of testing for COVID. The second type of test that has been developed is what we call the antigen test, and that's really looking for pieces of the virus itself. And as you can imagine, that might be a little less sensitive because it's looking for pieces of the virus and not really the genetic code of the virus itself. And so that's really the biggest difference. Now, we've found that the accuracy of the PCR test is, again, our gold standard. And if we compare the antigen test to the gold standard, we have found that in certain situations, they are pretty much as good. And by that, I mean into the 90s percentage of accuracy in certain situations. But we also know that in other situations, the antigen tests really fail and their accuracy drops to as low as 30%. And as we continue the conversation, I'm sure we'll talk about that a little bit more.
Yeah, to help our listeners differentiate, is the PCR test the one where you do the nasal swab?
That's exactly right. Actually, you know, the interesting thing now is with all of the tests that have come out, the nasal swab is actually the way to get a lot of our rapid antigen tests as well. So that's a little bit harder to discern now what test you're getting just because you're getting a swab, because it is kind of used for both now.
On the antigen test, is that also called a rapid COVID-19 test?
Yeah, and that's the sort of vernacular that has arisen. You know, rapid is sort of obviously it's a relative term. You know, we have PCR tests that take a couple of days to come back, and we have PCR tests that only take a couple hours to come back, and we call that pretty rapid, you know. But in the public vernacular, when people usually say rapid test, they usually are referring to the antigen test, because the antigen test only takes usually 10 to 15 minutes to get a result back.
You know, and you mentioned sometimes the antigen tests may not be as accurate. Some people think a negative result from a rapid COVID antigen test proves they don't have COVID. Is that true?
And that's really a fabulous question, because I agree with you that this is a point of much confusion in the public, and I think drives a lot of unintentional risky activity. And that is because of this. Your question is dead on. A negative result from a rapid test is only accurate in certain situations. It is about 90% accurate, again, depending on the branded specific test itself. But let's just say it is 90% accurate in the case of a symptomatic patient. And that is really the very important thing. Meaning, if you have shortness of breath, cough, fever, aches, those kind of symptoms, okay, and you have a negative test from a rapid COVID test, that is 90% accurate in that you do not have COVID and you have some other infection. So that's reliable. However, what we find that people are doing, a lot of folks are saying, wow, this rapid test is really great. I can find out in 15 minutes whether I actually have COVID or not. And they just go and get a test even if they have no symptoms. It is in that case that we know that these rapid tests are only about 30% accurate. And what that means is that is worse than flipping a coin. All right, so let me say that again. Negative results from a rapid COVID test for asymptomatic individuals is only accurate to about 30%.
That's unbelievable. And you hear all this discussion about, well, let's test athletes quickly with a rapid test before they begin a game.
Right.
Or let's test people before they get on an airplane, et cetera. And you're telling me that it's 30% accurate sometimes. So you really could be carrying the virus and think everything's okay.
Absolutely. And that's the really difficult thing. There are really two situations where this is really a problem. Number one, there are many folks in the community that are asymptomatic carriers. And what that means is you have no symptoms, but you are carrying the virus and you are able to pass that virus on to other people. Okay, we know from internal data here at Parkland that right now between 8 to 10% of the public is walking around carrying COVID-19, but do not have any symptoms and have no idea that they are doing so. All right, those people may come back with negative tests, but still are passing it around. That's one situation. The second situation is actually even scarier. The second situation is someone is walking around with the virus, getting ready to get sick. Because again, remember that this virus can take up to 10 days and maybe sometimes 14 days of incubation inside your body before you actually get sick. And so what ends up happening is folks end up testing negative, but actually end up getting sick a day or two after the negative result. So that is an even more dangerous situation because they're even more infectious than the people who are just carrying it around and aren't going to get sick. So really, the negative test on an asymptomatic individual, we actually find that causes more infectivity around the city than anything else.
That's amazing. I'm going to throw 3 quick scenarios at you to benefit our listeners. Let's assume one of our listeners has no COVID symptoms. They don't think they've been exposed to anyone with COVID, but they really want to know, do I have the infection? What do you recommend as to which test they should take?
Well, so that situation, Steve, in fact, I would not advise testing at all because, again, of the scenarios that we have talked about already, in that a negative test does not mean that you do not have the virus simply incubating in your body, that it may show up later. So it actually gives you a false sense of security. So in my mind, my advice for the public is if you do not have symptoms, getting a test should not reassure you either way. If you're required to get a test for whatever reason, then the PCR test in an asymptomatic individual is the only one that even has a chance of being accurate. But again, remember, it is only accurate for that moment in time. Just because you're negative today does not mean that you won't turn positive tomorrow.
Good point. Scenario number 2. the individual has mild COVID symptoms, should they get a test? And if so, what type of test?
In that case, you should definitely get a test. When you have COVID symptoms, and the most common, of course, we've all heard about: loss of taste, loss of smell, fever, cough, shortness of breath, even some gastrointestinal symptoms like nausea or diarrhea can be caused by COVID. So in those cases, actually, I would suggest that either test would be appropriate because, again, you are symptomatic. So when you are symptomatic, we know that both tests are accurate. PCR is always going to be better, but we understand that is a harder one to get. So in the case with symptoms, the antigen test is perfectly acceptable.
I think I know the answer, but for our listeners, you have really severe COVID symptoms. What type of test?
If you have really serious symptoms, I think the first thing I would advise everyone is go to a medical professional, okay? I would not take a risk of doing any of these at-home tests or anything like that, even though the result might be accurate, and it probably will be if you're feeling seriously ill. The important thing, if you're seriously ill, is to make sure that you don't need a higher level of care. Okay, so my first piece of advice for people who are seriously ill with symptoms is to go to a medical professional. Number two, to answer your question specifically, if you are ill with COVID-like symptoms and it's severe enough that you feel like you need to go to a medical professional, then the PCR test is absolutely the right one to get.
Dr. Joseph Chang, he's the Chief Medical Officer at Parkland Health and Hospital System, a huge position in our community over this past year. When we come back, we're going to be talking about quarantining. Should you or should you not? And on what criteria? More with Dr. Chang next on the human side of healthcare.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome back. We're talking with the Chief Medical Officer for Outpatient and Ambulatory Services at Parkland Health and Hospital System, Dr. Joseph Chang. And here is an important question or scenario. If you have been exposed, if you know you've been exposed to COVID, but you don't have any symptoms, are you supposed to quarantine?
So at this point in time, the recommendation is this. If you know you have been exposed, you must quarantine. There's no question about that, okay? And the reason is because you do not know in your particular situation, in your particular body and physiology, how long COVID might incubate in your body before you show symptoms. And so you must quarantine. Currently, the recommendation is you should quarantine for at least 7 days. And that is because the average amount of time for incubation for COVID inside someone's body is about a week, okay? Now, if you are planning and wanting to get out of quarantine in a week, then at that week point, at that 7-day point, you should get a PCR test. If that PCR test is negative, you may leave quarantine in 7 days. If you do not have access to a PCR test, then you must quarantine for 10 days, okay? So that is the current recommendation from the CDC. And again, I would remind our listeners that the antigen rapid test is not appropriate in these situations when you have no symptoms. So if you want and would like to get out of quarantine in 7 days, you must have access to a PCR test. And if that is negative, then you can come out of quarantine.
Thanks for those answers. I just want to ask another question. I have a friend of mine, and he wanted to visit his grandparents. And he talked to me, and I said, maybe you shouldn't go this year. Maybe let's wait and do it next year. He said, no, I'm going to get a test before I go and get a test when I come back. I'm going to see my grandparents. Now, I'm not trying to second guess, but was that a risk?
Listen, I think the advice that you gave your friend is entirely 100% the right advice. And again, I know we've said this a couple times already, but getting a test when you have no symptoms should not reassure you that you are not carrying the virus or that you will not actually get sick with the virus within a few days. And so going and visiting certainly elderly individuals who we know are at risk for severe complications with COVID is really not a good idea at this point. You know, I've said this in many different forums, Steve, and I will say it again. I am a family guy. There's nothing more important to me than my family. Yet I have really avoided seeing my parents. Unfortunately, my grandparents have already passed away, so I'm unable to visit them anyway. But I've avoided visiting my parents who are overseas for about 1.5 years now because of my fear that I would inadvertently take them COVID. And so your advice is absolutely correct. You know, at this point, we really should avoid any sort of risk that we would be infecting our family members, especially those with either pre-existing chronic health conditions or the elderly.
So what about these home test kits that are in the drugstore now? Tell us more about those and how they work.
Yeah, it's really amazing, you know, what innovation has led to over these last, 9 or 10 months now that we've all been living with COVID-19 as reality in our society. Currently, right now, there are 3 more common home test kits that have been approved by the FDA. 2 of them are of the rapid antigen type, all right? But the newest one from the Syra actually is a pseudo PCR technology. It's, of course, not as good as the hospital-grade PCR technology that we use here at Parkland and other health facilities. However, it is a PCR technology, so it is inherently going to be more accurate, especially in asymptomatic situations, than the rapid antigen tests. So that sort of speaks to how they work. Currently, 1 requires a prescription and 2 do not. And as you say, you've seen them sitting on the shelves at certain stores already. And the costs actually kind of vary. I've seen reported anything from $15 to $20 for a retail price anyway for an antigen test, up to upwards of $50 to $100 for the, again, sort of pseudo PCR level test. Of course, retail price to get it with insurance may be a little bit less. I don't know how all of those contracts work, but that's sort of what you should expect. And again, as far as the accuracy is concerned, we've already talked about the rapid antigen tests. The correlation between the pseudo PCR test and our gold standards are really good at this point, really over 90%. There's not been enough experience with that newest Syra test to be able to know how accurate it is exactly in asymptomatic situations, but certainly in symptomatic situations, they are working very well. So that's sort of where we are on the home test kits. The thing to remember on the home test kits really is the collection of the sample itself. When you're doing the collection yourself, there is some risk that you do not correctly do the swabs. And actually, these companies have been really good about putting out YouTube videos and instruction booklets and things like that to make sure people are doing the sampling correctly. So that's the only wild card with these home tests, is that you have to do the sample yourself.
You know, Dr. Chang, let's go back to the antigen test. You know, the one you said if you don't have symptoms, it's only accurate 30% of the time. But what if you test positive? Is that accurate?
Yeah, that's a great question and a very nuanced question. And to that point, you are correct in that if it is positive, then false positives are actually at very low rate. So you can believe a positive test, but then it's the negative test that is kind of sketchy. You're not sure whether to believe it or not.
Here's something. Thomas and I have interviewed quite a few physicians, and something that you said, I think we need to repeat for the listeners. If you're showing severe symptoms of COVID, you need to seek medical professional help. And the reason I say that, we interviewed a neurosurgeon a couple of weeks ago. He had a 38-year-old male who was in excellent shape, jogged, etc., got COVID symptoms, kind of put off, finally came to the hospital, and he had a stroke. And the stroke was related to that. That's why it's so important.
Oh, yeah. I mean, that's just a terrible, tragic example. You know, most of us young folks, we do this, right? This is not uncommon. I'm guilty of it myself. You know, we kind of feel sort of bulletproof, and we tend to just say, well, whatever I'm feeling will get better. And while that is the case most of the time, for those who are feeling the symptoms, it's impossible for us to know whether this is the time where things are going to get really bad or not. And, you know, with something like COVID floating through our communities now, I can't stress hard enough that should you start having real difficult symptoms, better part of valor, go get some evaluation. We do see this in the hospital a lot. Folks who just put it off thinking, you know what, I'm going to be okay. And then when they come, they have something that I cannot reverse. And that's really sad when those things happen, because I know if they come in earlier, likely I would have been able to fix that. So absolutely great point to make, and one to be stressed over and over, is that please don't be shy to seek out medical attention. We are here for you. This is why we are here, and you are never bothering us. We need y'all to come in if you need to.
We've been listening to Dr. Joseph Chang. He's the Chief Medical Officer for Outpatient and Ambulatory Services at Parkland Health and Hospital System. Dr. Chang, thank you so much for all of your contributions. Obviously, a big week coming up, and we will continue to cover the COVID story here on the Human Side of Healthcare. We'll see you next week on 1080 KRLD
and radio.com.